Welcome back to Carolina Women. We are on a field trip here at Revive Rehab, my favorite place. We're actually in the room of Rehab right now.
It's our PT gym.
Exactly.
Yes.
Allie, thank you for joining us today. Let's talk a little bit. This is the PT gym that you actually bring people in to do what?
Yeah, so part of our rehab is, again, we believe in not just necessarily treating our patients on a table lying down, right? Because it's just not functional in our daily life. We have to care for our children, lift things, laundry, you name it, right?
Yes.
Work. And so we do a lot of functional exercise. So we do a lot of core hip strengthening, lower body strengthening. As you can see, we use a lot of different, we like to use kettlebells. We like to encourage our patients that yes, you can lift heavier weights. There's a proper way to do that. Even if you have issues like prolapse and things, actually getting stronger is one of the best things you can do. And I think a lot of our patients are afraid to do that because it's going to make their symptoms worse, but it actually makes them better.
What's really been interesting all the times that I've talked to you and to Jen is I've learned so much about, I guess, the myths of physical therapy and how holistic a practice it really is and what you do in so many different areas. This is also an anniversary for you all.
Yeah, so we have been open for 1 year officially, 1 year in business.
I can't believe it.
So it's very exciting. We're doing a couple different things this month. So we had a lot of success with our diastasis screenings like we talked about last time. And so what we were doing is offering free 15-minute screens to come in and see if you have something, and then if you do, we'll give you a couple of tips, or you can also become a patient. We offer different things. So what we're doing this month is orthopedic and pelvic screens. So if you're on the fence, like, hey, I think I have this issue, my back's been nagging me, or I do have some leakage or some pelvic concerns, and you're not sure, you can schedule on our website or call us, and we'll set up a little screen for you, and you can come in and see, hey, is this a good fit for me?
What's really interesting about that is when I walked in today, I'm like, gosh, every time you talk, every time I come here, I'm like, because I say it all the time, I'm gonna make an appointment, I'm making an appointment. And I think for all of us, that's our intention.
Yeah, and life gets busy.
Exactly. But you know what, today I'm going to make an appointment before we leave because I do think these kinds of screenings, I'm big on prevention. And as I'm getting older, I want to make sure that I can do what I can do.
Absolutely.
So who would be a perfect person for these screenings? Obviously older.
Yeah, so it could be any age, really. So maybe you're older and you're like, I'm having some weakness. I might have some incontinence issues. I might have some weakness. Maybe you have any bowel or other bladder issues, any sexual dysfunction. So anything where you're like, I don't think this is normal, but I've kind of been ignoring it. And so you're trying to maybe look at, hey, how can I prevent this from getting worse? How can I get treatment? Because you don't have to live with those symptoms.
What's really interesting is I have a daughter in her mid-30s who has kids, and so her whole group are younger. And it's funny when we all get together, those kinds of discussions are becoming more prevalent.
Yes. Which is so exciting because people are actually talking about it.
I was just going to say, so it's not so stigmatized and so secretive now. And so what you're saying is, if you've had kids, if you've just had kids, and you've got some of those issues, just come check it out.
Yes, and you don't have to suffer. And I think, what we're seeing now is even with a lot of the doctors that send patients to us is they're sending patients before they even have problems.
See, I love that.
You had a baby, come on in and let's check you out and let's make sure you don't have any problems. So it can go both ways. Like, you don't have to wait until you have a problem to come see us.
Are there, and I see a lot of pregnant, adorable pictures, are there things I can do when I am pregnant that can also be prophylactic or help me in prevention?
We actually do a lot of different pregnancy packages where patients can come see us throughout their pregnancy so that we can prevent issues like abdominal separation, prolapse, and just help you with your aches and pains. We're also offering 15% off all of our packages for September, if you book with us in September, just as like a celebration of our 1 year anniversary. So yes, we love seeing patients during pregnancy as well.
I love talking to you, and we're going to take a break now here in Carolina Women. I'm going to go make an appointment.
Thanks.